Hi there, it's Matthew here, the veterinarian at Ferndale. Today will be quite a technical explanation of how the BOAS test works in practice. So I'll be showing you the BOAS test form and going through it to show you, if you're having a BOAS test, what your pet will be graded on. Now, this will be relevant for certain airlines like Qantas or Cathay Pacific or Emirates. There's certain airlines which it's mandatory for your pet, depending on their breed, to have this test to make a booking. So, for example, to fly a pug to Australia, you need to do this test with Qantas, or even with Cathay Pacific. There's other cases where it's not mandatory to do this test, but it's recommended. For example, if you're flying an English Bulldog, pretty much anywhere in the world, then the breathing of these lovely dogs is quite noisy, is more challenging than some pets, and so for for health reasons and safety reasons, it's often recommended to do a BOAS test. So I'm going to jump into the BOAS test and talk you through it. Okay. So first of all, so this is a 3-page form. Okay. The first page, at the top of the page, it really just lists the pet details, the owner details, and the kind of travel plan. Okay. So the first thing which veterinarians do is we need to get the medical records from your previous veterinarian. So we need to know, uh, in particular, has your dog had BOAS surgery before? So have they had some surgery to help with the nostrils, or the like the windpipe, the soft palate? Have they had some upper respiratory tract surgery before? So we look at the history. We also, if we're doing this test, we look at the medical history to see, is this patient on any medicines? Like, are they taking any long-term medicines which could give us some facts and some information about the pet's health? In particular, we want to know about heart disease, and we want to know about seizures. Okay, so yes, there's this section about medical history where the veterinarian has to record this down. Okay. There's then also, um, okay, and I have to say, if your dog has, um, has a history of seizures or is on seizure medication, then flying your pet internationally is of increased risk, because there's going to be some period of time when your pet's not supervised when they're in the plane, and so if your pet is having regular seizures, then it's going to be a concern if this happens during the airplane. Of course, there are some animals whose whose seizures are controlled with medicine and perhaps have not had seizures for years or for months. Um, these ones, of course, the risk will be less. But if you if you kind of stack on top other risk factors, for example, being brachycephalic, so having a short face, like a short nose, then the risks elevate. If your pet has heart disease, so there's a lot of pets do travel with heart disease, with um, taking vetmedin or taking Forticor, taking heart medicines. Um, but there's a difference between having heart medicine, which is just kind of supportive and is being given because your pet has not actually ever experienced heart failure, but is it like at a borderline situation where the veterinarians have some level of concerns and have recommended it. So they've done X-rays, they've done a heart ultrasound. They know that yes, there's a heart murmur, and they know that there's some changes to the heart valves or to the heart wall thickening, and so they've started on kind of electively, preemptively have started on some heart medication. This is a different risk situation compared to a dog which has had severe heart disease before and has been hospitalized with heart conditions and has had pulmonary edema or some coughing, some symptoms relating to heart disease. And so if your pet has had this type of thing, of course we need to know. That's why we check the history, or this is why it's part of this form. Okay, Then we do a physical examination. Physical examination, we're looking we're looking at the pet, and we're examining the pet, and we're using, you know, uh, our experience, but also, the stethoscope, um, any kind of, simple, palpation and such, to try to get an idea of the pet's health. So we look at the cardiovascular system by looking at you know the color of the gums, listening to the heart with a stethoscope, checking the rate and rhythm. It sounds normal. We're watching the breathing and listening to the breathing. We 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 check that there's no obvious other abnormalities. Um, so it asks about the central nervous system. I guess this would a little bit be more to do with, um, if if the pet's vision is compromised, um, or if there's signs of having had a stroke before, or if signs of hind limb paralysis or something like that. Um, the musculoskeletal system. So how is their muscles? How are the joints? The knees, the hips, any abnormalities? So we just record all of these things down. Then we need to know about the body condition. Okay, there's a condition score. Let me jump to this. Okay, so actually, you can probably find online. Veterinarians do use like a a objective scale to give an idea about your pet's health. Sorry, your pet's weight. Okay, so just to say, the being underweight would be, 1 or 2 out of 9 would be, the ribs are visible. The ribs, can be felt. There's no palpable fat. The pet is very, um, defined in around the chest, around the abdomen, or tucked in. So this is too thin. On the other end of the scale, we've got like 8 and 9 out of 10, where the the silhouette, or the body shape is very different because of obesity. Okay, so we're hoping more for 5 out of 9, 4 out of 9, where you can feel the ribs, where there's some body shape, the body's well proportioned. Okay. Now, why does this matter? This matters because pets don't lose heat by sweating like people do. Pets lose heat by panting. So there's evaporation of moisture from breathing, and pets cool down from panting. Now, if you're very overweight, then um, essentially you're just going to be easier to overheat. So it's just, you're more likely to be able to overheat, which is going to affect your breathing, um, and also just generally more likely to be a sign of poor fitness. And of course, having good general fitness, cardiovascular fitness, respiratory fitness, joint fitness, having generally good fitness is going to be helpful for travel. I mean, or for anything, but travel is a period of time when there is slightly elevated stress compared to normal, because the pet's on his own, is in the aeroplane or in the cargo facility, where you know pets have uh, their dog's sense of smell is uh, 1,000 times more powerful than human sense of smell, and then their sense of hearing is 2 to 4 times more powerful. So the cargo terminal has got a lot of loud sounds. There could be high pitched sounds which we can't hear because dogs have a higher auditory range, and there could be some unusual smells. And so if you're overweight, um, then it's just uh, another stress on the body. So it's better that you're in fair shape, reasonable fitness. Okay, so the you're given a scale for your body condition. And then also you're given a scale for nostrils. Okay, so there's a grading from 1 to 4. Open nostrils, grade 1. This would be like a Labrador, or perhaps a large breed, maybe like a German Shepherd dog, or a mongrel, like a kind of village dog. And this can can have stenosis. Stenosis means like narrowing, and this is due to genetic issues and the breed. And some breeds, or some individuals of some breeds, can have very severe stenosis, like very severe narrowing. So this is grade 4, like the worst scenario. So essentially, if you have stenosis like that, you can't breathe through your nose, um, and then that then affects your breathing, which then affects your heat, your cooling down, your heat loss mechanism. So this is something which is considered. Okay. We also look at the temperament. So what I tend to do is put the pet inside the travel crate and see what their temperament is like. So normally we ask the mum or dad to leave the room, so we can observe the temperament when nobody's there. And we even leave the room. So we just do the test for a minute or so, just to see how they are in the crate. So so this is also a factor. Okay, so the veterinarian is considering all of these different factors, and you can also try to consider what of these things might be able to be improved. So the you know the temperament in travel crate can be trained over by crate training over a period of 6 weeks plus. There can be training. Okay, the general health can be improved with exercise, careful exercise in air conditioning or in cooler weather if you're a breed which is going to be prone to having issues. Okay. Okay, so for the BOAS test, for the assessment, the the assessment we're looking at the breathing effort. So the breathing in, is this is this like is this noticeable or not? So most dogs, there's no real effort, okay? Um, but is there effort with the rib cage having to move, or is there effort with the nostrils having to flare and widen when you breathe? Okay, so this is graded. This is graded, from not present to severe. Then is there something called stertor? So you can actually look at videos on the internet of what stertor is, what stridor is. They're different sounds. So stertor is more like a wheezing sound, and stridor is like more like a squeaking sound. Now again, this is graded. It's graded on how noticeable it is. Now, if it's severe, it can be heard actually without a stethoscope. So you can hear this on on your own dog. Um, if it's moderate, actually you might be able to hear it without a stethoscope as well. Although it's only intermittent. Now, if it's mild, actually the veterinarian will have to use a stethoscope to listen. So this is putting the stethoscope on the chest or on the windpipe to listen to this sound. Yeah, so they grade the squeaky sounds, and they grade the lower pitch sounds, and they just have to comment about whether or not your dog um, basically faints or turns blue, which of course shouldn't be happening in a standard assessment because because your dog's not done anything. Um, but there are some dogs which, with excitement and with being stimulated, can get stressed out and can even go a little bit, cyanotic, which means a little bit blue. So, and of course, those ones would be a travel risk. Okay. Then the same thing is done after exercise. So the dog is meant to be kept active for 3 minutes. Actually, they use the same form for dogs and cats, but cats don't have to do this exercise test, and um, and of course, cats don't tend to be so affected by these breathing issues. But yes, the dogs have to essentially like be trotted up and down or run up and down for 3 minutes. Okay. Um, Now, if it's a hot day, water needs to be provided, or they need to be able to go straight back into AC immediately afterwards. It's better to be done in the shade. It's better to be done not on a hot day. So we're not trying to make any kind of risky situation. We're just trying to assess how the breathing is with a few minutes of exercise. Okay, and yeah, so I've done perhaps about 50 or so of these tests. We try to do approximately the same standard situation for every pet, so we can cross check with how other pets have behaved. Now, okay, page 3, the kind of final page. Essentially, we've got to make an assessment of whether or not it's fit to fly. So um, we we give we go back, we look through the chart. Actually, if there's serious medical conditions, then you're not fit to travel. If there's very serious medical conditions such as seizures, which are not treated properly, um, we consider the obesity, we consider any stenosis, we consider the temperament, and in particular, we look at the BOAS test. And for bulldogs and pugs, we look at the BOAS test after exercise. Okay. Then, if you got no symptoms, then you can pass. If you have got severe symptoms, so this means actually, for example, after breathing, the dogs are constantly making, sorry, after doing the running up and down, they're constantly making uh, upper airway sounds which are not stopping and which are audible, even without a stethoscope. Then that's a problem. Certainly, if they have inspiratory effort, so breathing with difficulty, so needing the nares, the nostrils flaring. If they go blue or if they faint, then they can't fly. Okay. The more difficult area is the ones with moderate symptoms, grade 2. So where they have some upper respiratory sounds, and other risk factors such as being overweight, other medical conditions, being anxious or excitable. Okay, so these ones are grade 2. They 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 warrant careful assessment. Okay, so essentially we grade them out of 3, and then we make a decision: do they fly or not fly? Okay, so grade 3 can't fly, and the other ones can fly. So there's a lot of different factors which go into the decision. Okay, so I tend to recommend doing this test twice. I tend to recommend do the test early on when the flight is being, the pet move is being considered, to give you more confidence on how your pet's flying is going to be, and how the pet's breathing is going to be, and whether or not it's there's any airway risks or not. At this point, this early stage, the veterinarian can assess, the fitness, the body weight, and the anxiety, and the how comfortable they are with the travel crate, the temperament. Okay, they can assess all of these things and make a plan for improving these things before the travel date. Some pets, maybe they're young and healthy, but they do have serious breathing issues. the veterinarians could recommend some airway surgery to help with the nostrils, to help with the soft palate, something like this, because the benefit of it is, if it's done well, then this pet can breathe a lot better for the rest of their life, and so then they can have um, more a more active lifestyle because of better breathing. Um, of course, then normally this test depends on the airline. This just has a validity of 30 days or 60 days. Will probably need to be repeated just prior to travel. So it depends on the timing of it, whether or not one test can be done instead of two tests. But for places like traveling to Australia, if the breed is a higher risk breed, then there's arguments to say do it twice. Okay, so that's the technical aspects of how this test works. The reasons why we do the test are because of the airlines require us to do the test, but also because of safety reasons. And it all comes down to the dog's physiology and anatomy. Why a dog with a long nose will be able to cool air down better through panting, traveling over the tongue, traveling through the nostril, and will be able to inhale and exhale air much more efficiently and effectively compared to dogs with more obstructive diseases, like obstructive conditions, such as having small nostrils, overly big soft palate, means that it's more like breathing through a straw or through a snorkel, and so it's harder to breathe. And so then, if you're getting very anxious due to the pet's anxiety, or due to the environmental conditions of travel, then they can't improve, like they can't increase the frequency of the breathing, and so then they can't cool down, and so there's increased risks of heat stroke and heat overload. Okay, feel free to ask any questions in the comments. Okay, thanks for your time.